How does hip weakness contribute to ITBS band syndrome? Have you ever wondered how hip weakness can lead to that nagging pain on the outside of your knee? Let's break it down. Hip weakness is a major factor in the development of iliotibial band syndrome, especially for athletes. This condition often affects those involved in repetitive activities like running, cycling, or playing soccer. The iliotibial band is a thick band of tissue that runs from the top of the pelvis down the outside of the thigh to the shin bone near the knee. Its main job is to stabilize the knee during movement by connecting the muscles around the hip to the lower leg. When the muscles around the hip, like the gluteus medius and gluteus maximus, are weak, they struggle to keep the pelvis stable. This instability can cause the pelvis to drop on one side during activities like running. This is known as hip drop. When this happens, it creates an imbalance that increases tension on the iliotibial band. As the band rubs against the outer part of the thigh bone near the knee, it can become irritated and inflamed, leading to the pain associated with ITBS band syndrome. Specifically, hip weakness leads to increased tension in the iliotibial band. When the hip muscles cannot handle the forces during leg movement, the band tightens too much. This also alters how the leg moves. If the pelvis tilts or drops, it changes the alignment of the leg, causing the iliotibial band to rub against bony structures more than it should. Over time, this abnormal stress can lead to an overuse injury. For example, if you run thousands of steps without addressing this imbalance, it can result in inflammation and pain. For those in athletic training careers, understanding this connection is essential. Athletic trainers, physical therapists, and sports medicine professionals focus on assessing hip muscle strength and gait patterns. They use physical exams and movement analysis to identify weaknesses. Rehabilitation is another key area. Trainers design specific strengthening programs for the hip and core muscles to restore stability. They also educate athletes on proper training methods, stretching, and strengthening exercises to keep the iliotibial band healthy and prevent future issues. Treatment often includes manual therapy, stretching, and corrective exercises. These approaches address both the knee symptoms and the underlying hip weakness. In short, hip weakness contributes to ITBS band syndrome by destabilizing the pelvis, increasing tension on the iliotibial band, and changing how the leg moves. Strengthening the hip is a vital part of treatment and prevention for athletes dealing with this condition.